Hi, I'm Dr. Tracy Marks, a psychiatrist, and I make mental health education videos. Today, I'm popping in very briefly because I want to tell you about medications that can be affected by taking them with or without food. It's not a terribly long list, thus this being a brief video today, but nonetheless it's important because sometimes medications, if you take them with food, can delay the absorption of the medicine, pushing back when it actually takes effect, or it can increase the concentration of the medication in your bloodstream. Increased concentration can mean increased side effects, or it can reduce the amount of the drug that's absorbed. Reduced absorption means that you're not getting as much of it in your bloodstream, and therefore you can take a medication that way and think, gosh, this medicine doesn't work for me. This is a failure. Well, it may not be a failure if you took it with food. So here's the short list of medicines that are affected that way. And I'll have a handout for you with these medications that you can download from my website at markspsychiatry.com. If you're on my email list, you already have this handout in your inbox. For this video, I'm going to say the brand name, but the generic names are included on the handout. First is the sleeping medicines. Have you ever taken sleeping pills before and it took forever for you to feel sleepy? It could be because you took the medicine too close to eating your last meal. Several of the sleeping medications should not be taken with food because food delays the effect of the medication by delaying absorption. These medications include Ambien, Lunesta, Sonata, and Trazodone. If you take them too close to eating, the food effect can delay when you start to feel sleepy by an hour or more. This is a big deal. If you're taking the medicine to help you fall asleep, you don't want to lie in bed for an hour or two waiting for the medicine to kick in. So what would be considered an empty stomach? Well, generally we consider it anywhere between 1 and 3 hours since you last ate. Since this is a medicine that you would take at bedtime, I usually advise people to have dinner 2 to 3 hours before they want to take the medication. In case you're someone who reads the medication handouts, or labels as we call them, the label for Trazodone will say to take with food because food increases the amount of Trazodone available, so you get a little bump in the concentration. But the label also says that food delays the effect of the drug by 1 hour. Well, Trazodone is FDA approved for depression, and that's its intended use. But it's rarely used for that purpose and mainly used to treat insomnia. So that said, the food delay becomes more important than that bump in concentration, so it's still best to take it on an empty stomach. Another medication that you don't want to take with food is Seroquel extended release formulation. We use Seroquel for depression, bipolar disorder, and schizophrenia. Seroquel immediate release version has a lot of side effects, including feeling very tired and sleepy, maybe even dizzy. So they came out with the extended release version to help smooth out some of those effects so that you can take it during the day and still function. If you take it with a full meal, especially a high-fat meal, the food causes a sharp rise in how much you have in your bloodstream, and you may get the same side effects that you would get with the immediate release version. So it's not horrible if you take it with food, but you can end up having some of the same side effects as the immediate release version, and then it's kind of no point in taking the extended release version. Next are the medications that do not work as well if you take them with food because food decreases the bioavailability of the medication. This means that less of it is available to be absorbed in your bloodstream. And these medications are Latuda and Geodon, which are both antipsychotic medications that we use for bipolar disorder and schizophrenia. Also, this applies to the antidepressant Viibryd. If you take these medications on an empty stomach, or just having a light meal like a piece of toast, you won't absorb as much of it, and then you may not feel the effects of the drug. It still may work well enough, but you could require higher doses than you would otherwise need, or you could conclude that the medicine just doesn't seem to work for you. With the medications Buspar and Invega, the amount in your bloodstream doubles with food. Buspar is a medication that we use to treat generalized anxiety disorder and off-label for treatment-resistant depression. Off-label means that it's not what the drug was FDA approved to treat. Invega is a drug that we use to treat schizophrenia. Because of this doubling effect, you may need a lower dose, which is fine, but then you always need to take the medication with food so that your blood level isn't always going up and down. The downside of this plan is that Buspar is usually a 2 to 3 times a day medication, and you may not want to have to always coordinate your eating around taking the medication. So in this case, it may be easier to take on an empty stomach or wait about a couple of hours since you last ate to take the medication. It's always a little trickier with medications that you have to take more than once a day. So the moral of the story with the Buspar and Invega is that whatever you choose to do, whether you take it with food or without food, you just want to do the same thing each and every time. Consistently take with food or consistently take on an empty stomach. Notice there are no antidepressants on this list with the exception of Viibryd, which is a relatively new antidepressant. But the common ones like Prozac, Zoloft, Lexapro, those are not medications that are significantly affected with food, at least as far as the amount of it that works for you. Where it can matter with these medications is how food affects your tolerability of the medicine. A lot of these serotonin-enhancing drugs can cause a lot of nausea because we actually have more serotonin receptors in your gut than in your brain. So anything affecting the gastrointestinal tract is common for these medications: nausea, queasiness, diarrhea, constipation. And so if the medication causes a lot of nausea, sometimes taking with food can actually help with that nausea and make you be able to get it down or be able to tolerate it better. But it doesn't change the overall effectiveness of the medication. I hope if you're taking one of these medicines that I did mention, that where food affects the blood levels, I hope that you're able to see a difference in the effectiveness just by adjusting your eating schedule around the medication. If you're not on one of these medicines, then save the handout as a reference for the future in case you get put on one of them. Also, pass it along to someone that you think it may benefit. Thanks for watching. See you next time.